Welcome to Medical Confessions,
your remedy for serious medicine. I'm Jen.
I'm April.
And I'm Scott. Today we're going to be doing something a little bit different. Instead of talking about a specific topic, we've all done a little research and we're going to present to each other some of the funniest things we found in medicine lately. We're going to title this, You Can't Make This Stuff Up Because You Can't. These are true medical oddities. None of us know what the other one is going to present, so it's going to be a surprise for all of us. Hopefully you enjoy it.
I'm excited about today's episode. 2 reasons. Number 1, we have a new camera, so that's exciting. So if you can now see our wrinkles and blemishes and our extra 10 plus pounds, it's because we have a good new camera.
We do apologize for the blurry nature of our old one, but it did come free, so that was nice. This one we actually paid some money for, so hopefully you enjoy the show a little bit more.
Absolutely. And then I'm excited about this episode because I feel like this is how most good conversations happen, more organically and people just talking. So I'm excited that there was no real defined homework done. So now we're kind of like, it's like Christmas. Like, what have you got? So.
Ooh, who wants to go first?
I can go. Do you want to hear mine?
I'd love to hear yours.
I don't normally need notes, but I want to make sure that I get this right. So this is actually ABC News reported this in 2010. So, but the event actually took place in 1988. So there's a 15-year-old girl who became pregnant, this is in an African nation, and went into the doctors with all the symptoms of pregnancy, so and delivery, imminent delivery. They couldn't figure it out because on their initial exam, and it looks like she even presented maybe as being pregnant, but on their initial exam, she didn't have a uterus. I'm sorry, well, yeah, she didn't have a uterus. So they were like, how can this be? Well, it turns out as they were trying to figure out what was going on with her, and probably before any heavy testing had been done, they looked up her record and they found out that exactly 9 months earlier, she had been admitted to the hospital with a knife wound to her abdomen. This is where it gets crazy. Okay, so she and her then boyfriend, and I think, maybe still, were engaging in fellatio. They were caught in the act. Right, at 15. They were caught in the act by her previous boyfriend. Ooh. And a knife fight ensued.
I can see why.
She was stabbed twice in the abdomen and then was treated at the hospital. They cleaned her out with salt water. She went home. 9 months later, she's now in the hospital presenting as pregnant. Turns out that the semen made its way through her gastrointestinal tract into her reproductive organs, and she became pregnant. Now, the thing I can't find is exactly what region. I know, but Scott, I did research. I found 4 different sites that all said the doctors that looked at it said it is plausible, and they actually go into a plausible explanation for this pregnancy is that the sperm gained access through the reproductive organs via the injured gastrointestinal tract. Infertility experts note the story, which resurfaced in Discovery Magazine blog. And it goes on and on to talk about how it's an unbelievable set of coincidences, but they did a cesarean section and she delivered a healthy baby.
Well, and my thing isn't that can't happen, because that is like a series of unfortunate events. For me, it's so the logistics nature of it. Was she stabbed and then he completed the task, or did he complete the task?
She had ingested it, and they talked about the ability. So that's why I had to read this like 4 times to figure out what they were trying to say. Was the knife, contaminated? So she had ingested it just before the knife fight. During the knife fight, so she was stabbed twice. Somehow, whether it was through the GI tract, like a tear in it or something, the sperm leaked out. And so they go into a whole section of this article about how hardy sperm really is. And even if you kill off 90%, you still have and it's coated in this, fluid.
Because that's a pretty acidic environment.
That's what it talks about.
So, because when you said that in my head, I thought, okay, did he kind of finish all over her stomach and then stabbed and then?
They're surmising that it came from the GI tract itself.
Interesting.
And then, of course, she was under the impression she had no uterus and would not be able to carry. So the thing I haven't figured out, and none of the articles that I read explain how this baby.
Yeah, how did it propagate then?
I don't know.
Because I do know there was a history of like men can become pregnant. They like implanted the the fertilized egg inside of
Right.
his small intestine and large intestine that grew that
And I
way.
don't know, it talks about how, fertilization takes place in the fallopian. I don't know exactly what reproductive organ I'm not sure exactly. Or I've heard of not having a uterus, but maybe it's a uterus that's not functioning, like it's not connected to the vagina, like the vagina, so that, I'm not sure exactly. But I learned just enough to make it really interesting. I'm like, that is crazy. I got pregnant from a knife fight. And then I wondered about it, and then I was like, okay, so
I didn't think you could get pregnant that way.
But and it was found to be that the baby was the child of the boyfriend that she had just done the fellatio with. So, but what is curious is the jealous boyfriend, is he claiming right, since it was his stab wound that actually created, is there like a custody battle?
I was the one that penetrated.
Right.
You were the one. Interesting.
Right?
That is.
I thought it was interesting.
Maddening.
Yeah, and it made me think about how many times we've dealt with pregnant patients and stuff, and you hear these stories, or you see it on TLC, these women that go almost through their entire pregnancy and not know.
Oh, yeah.
Myself, and we've talked about this, but like, there is no way that I would have not known I was pregnant.
Oh, yeah.
I mean, it was obvious, even with my first child. So I can't imagine, as young as a 15, even a first pregnancy, which is typically not as obvious. I still can't imagine getting to the 9-month mark.
No.
Well,
Or being concerned of like a tumor or some other like serious medical condition.
I have 2 family members that claim that they didn't know
Really?
their entire
Were they
pregnancy.
larger? Were they bigger people? Because I've heard that before. Like,
Well,
maybe if you have a bigger abdomen, you're not going to notice
I think
the
you
growth.
just got indigestion and nausea for 3
Yeah,
straight
some of
months.
them
not
don't
that I
gain any weight.
noticed.
Yeah,
And
I didn't
there was some weight gain, but that's all that we thought it was weight gain.
Oh, so you like knew of them during this time?
Yeah. Mm-hmm.
And they just gave birth.
Yeah.
They're like, whoa, hello.
Interesting. That's a surprise.
Yeah, it
Merry
was.
Christmas.
It actually was on Christmas, too, that she delivered.
I feel like you just make stuff up.
Well,
Like, it's
I'll bring her in for a guest appearance.
Was it an aunt?
No, it was a cousin.
Oh, okay.
2 cousins, actually. One on my side, one on my husband's.
well, you guys have met my little brother. He thought it would be funny the first time his wife got pregnant to go the entire 9 months, never tell anybody, and then just show up for Christmas with a baby. But then he realized he'd have to go 9 months without seeing the family and thought that was too much, but he really wanted to give that a go. Just like,
How?
surprise, I've got a baby.
That would have been amazing if he would have done it and been like, well, I found it. Like, it was just in a cart and somebody walked away. So, like, if that would have been, could you imagine what
That's
your
the
family...
best joke ever.
Oh, I found it. You just take them.
I just took him. He's mine now. I found him. It's like a kitten.
I'm going to name him Herman.
Pretty bird. Pretty bird.
Oh, goodness. That's pretty,
All
pretty
right.
good. All right, you're up.
What's yours?
Mine is what I'm terming scandalously unfortunate. But so we all know that people have headaches. There's primary headaches and secondary headaches. Primary meaning the headache is the cause of your problem. Secondary meaning you have a headache from something else, like a brain bleed causing intracranial pressure, so you get a headache. That's a secondary. But there is a primary headache caused by orgasm. And it is described as a severe, sudden onset of an extreme headache that starts both sides and in the back, lasts for an hour to 72 hours for the intense pain, and then goes on for 2 weeks for mild pain.
Oh, my God.
Oh,
And it is brought on by the act of orgasming.
men and women?
It can happen to both. It's more common in men than women.
Wow.
So nobody really knows what causes headaches. There's some research been done, and they can kind of point to a few different things. Some people, it's a blood flow issue. Some of the 3 main causes of primary headaches would be migraines, cluster headaches, and then tension headaches. Interestingly enough, the headaches caused by orgasm can be either one of those 3. It could be a blood flow issue, it could be a tension issue, and then it can also, about 40% of people, actually it's a signaling something else going on in their body. So we'll start with, if you aren't one of those people that when you are in puberty and you're just starting to, figure things out and,
Yeah, like how bad
experimenting.
for like a teenage
Oh,
boy.
God.
His mom and dad are gonna be like, "You're grounded." Every time he gets a headache. I know what you've been up to.
Well, and that's the true, like, Catholic preacher. You can't do that, or you're, get hairy palms or something.
Yeah.
See, that's, you're not
Right.
supposed to. That's why you're getting, God's punishing you.
And
or
so is
whatever.
it like it's just that's what happens for life? Like it doesn't ever go
So
away?
some people, that is it.
Oh
It's
my
happening
Because I've
forever.
heard of people being allergic to semen, men, like their own semen.
What?
Yeah. It was, oh gosh, I should have brought that one up.
Yeah.
There's 45 different men that have been diagnosed with it, and I can't remember the name of it. I'm not Scott Hiskey, but, or Scott. Sorry.
We've gone so long without the last name.
We're going to have to edit that one out. No, like it's like a thing. Like people are allergic to their own semen when they ejaculate.
Interesting.
Yeah.
Oh.
Yeah. Darn it, I should have, that one looked boring to me. I was like, allergies, everyone's got them these days. And I didn't research that one more. But the first initial reading, I was like, ooh, that sounds horrible.
Wow.
Yeah.
Well, and so this one, if you are one of those that are in puberty and you have that unfortunate thing happening, you're probably going to have it lifelong. But there's 40% of people who it will start happening. So if you're one of those that in your 30s or whatever, it is happening, it might be 40% of those people have something else going wrong, like intracranial aneurysm, so a bulging of one of your arteries. A lot of it's there's arteriovenous problems where you can actually bleed into your cerebral spinal fluid. That'll be one of the causes. Coronary artery disease, stroke. Those are some other early, things that can cause these orgasmic headaches. The orgasmic headache just happens to be the first symptom that you have of this other problem. But there is that percentage of the population where that's just
chronic.
Unfortunate. So I was looking up the International Headache Society is the one who classifies headaches, and there's like 220 of them. And this is one of the primary ones. And so some of the treatments are things like let's just go with prevention, and they say the best way to prevent it is just to stop the sexual activity before climax.
Oh, what?
Yeah.
She's so offended right
Yeah,
now.
like what's the point, right?
Well, and I'm just like now, so all these like women that are like, not tonight, I have a headache.
Yeah.
Now they have now they can be like, not tonight, I'm going to have a headache.
Yeah, sorry, I don't want a headache. Yeah.
Well, and then my favorite one that I think I might just use an excuse in the future is because some of it can be caused by tension, and if you're doing it right, sometimes it's a pretty aggressive thing that you're doing, so you can get the tension headache. So they say one way to prevent it is to take a more passive role in the experience and have someone else do basically the legwork, and you can just lay there and go, thank you. And then,
Can it be prevented though? Like, could the person preventatively take Excedrin before engaging, and then they don't get the headaches?
So there are some treatments, but it's like all migraines. Nobody really knows the root cause. They just have some ways to reduce the symptoms. So one of the things they use is a class of drugs called triptans, and what those do is they actually constrict blood vessels and kind of help reduce the blood flow to the area causing the migraine. And they do that there's a receptor in your brain called serotonin receptors, specifically the 5-HT with subclass 1B and subclass 1D. Those are the ones, the receptor sites that they hit, and it'll help constrict your veins. There's some neuropeptides that they inhibit they'll help with that vasoconstriction. So you can take that, and that might help prevent it. Another drug they use is propranolol. It's a beta blocker, and we're familiar with beta blockers. And that will do a couple things for you. One is it slows down dromotropy, which is the speed of conduction of a nerve impulse. And then it also actually does that and helps vasoconstrict things by hitting those same two classes of serotonin receptors. And then the other thing is just an NSAID, a non-steroidal anti-inflammatory to help with the inflammation. But again,
how do I ask him something random and he answers, and it makes me feel so like I was like, she got stabbed, she got pregnant. That's like, whoa. Scott's like, oh, funny you ask.
Yeah.
There's 15 medically.
Well, you said read about something. You read about it,
That's a lot of reading.
Yeah.
It's more reading.
I'm
like,
I went surface
I
level.
gotta stop playing Candy
You go-
Crush and do my homework real quick.
Deep. I feel like for a man, that is a terrible thing to have.
That is a horrible
well,
affliction.
because if you think about too, like, I don't want to say it's necessary, but for men,
It's a release.
right? So it just makes me think of like, which is worse, you know, and like how horrible to have the need, but then to also have, you know, this.
Well, and over time, you're going to get that Pavlovian response. No, I don't want to because that's going to hurt versus I want to because that's amazing. So that's
sad.
I would almost want to take my chances with some sort of cancer or some sort of like diabetes or something.
That's
you know, epilepsy. Because goodness. That is unfortunate.
And it can cause all kinds of social and relationship problems and stuff. So.
Oh, absolutely.
Horrible.
I mean, that's why it's scandalously unfortunate.
Okay. All right, April.
Well, my next one is titled "In the Name of the Big Vein." Apparently.
Okay, carry on.
Apparently, a hospital in Bangkok recently experienced.
Emphasis on the right syllable.
They recently experienced a growing popularity in penis lightening.
Penis lightening.
Lightening.
I didn't know. I mean, I know that there's bleaching that takes place, but I didn't know that you would do that not on the penis. Like I've heard of anal bleaching.
Oh, right.
Yeah.
But
Scott's like
for
shocked.
like
I promise I have
for
not
cleaning
engaged.
purposes?
No.
No.
Like there's women that will go in and have their
because
stuff bleached.
it's darker and
It's
discolored.
darker.
They don't
Yeah,
like
yeah.
it.
And there is,
but I didn't know men did
skin
it.
lightening as
I mean,
well.
I guess men could be.
How
do the
much of a
bleaching also.
contortionist do you have to be to know that your anus is
I don't
discolored?
know.
I mean, are you looking?
I actually had
Are you
like
just
a
in the mirror?
Porn,
no.
for instance.
Well, yeah, but you're not looking at your own.
Some of
No.
us no.
I do not do that.
You know, I'm like, oh.
Well,
Don't do that.
and there's skin lightening, so they use a laser.
Michael Jackson style.
So apparently Thailand and other countries, and I know especially Vietnam. I have a friend whose sister does it. It's connected with...
But over there, it's not just genitals. It's like everything. Because if you go into like a store there's aisles of skin lightening and bleaching products. I'm not kidding. Like I went to Malaysia and my mom and I were like shocked at how many skin lightening products. They're like, it's like hairspray there.
Because they don't like their natural dark skin tone?
I think that, you know, to have more fair
It's
complexion.
connected with the social status. So
Right.
the lighter the skin, it's more beautiful over there. The higher the social status,
Because you're
it's
not out
all
working in the sun and doing damage to your skin.
okay.
Yes.
Kind
Yeah.
of
all
like being fat
connected
used to be
socially.
a
Yes. Social. Yeah.
social status. Okay.
So this, I actually have a friend over in Vietnam who
Where like
does
Americans
it.
have got it all backwards. We're all fat and tan.
Yeah.
Yeah, we're trying to get tan. They're trying to get light. Grass is always greener.
Yeah. So this clinic or hospital has about 100 clients a month. They charge $650 for 5 sessions, and
And so there's no damage to the. I mean, it seems like that would like. What if
'cause
you're allergic? I mean, like, doesn't it seem
What
like
if you get
chafe
that
or-
anal sphincter problem with your previous gassy thing?
I don't know. It's apparently growing in popularity, like, and it stemmed from they were lightening labias for women. So men heard about that and they started getting their penis lightened. And so, I mean, how vain? Like,
Well, and I guess I don't understand
labiaplasty.
because I don't think that that's ever been like
Well,
even a thought in my mind that that's a.
This might
Important.
become too personal, but I am not one that like gets excited about male genitalia, but two ladies that potentially do. I mean, is that a thing for ladies?
No, I mean, like it
the
never
color,
even
does
occurred
that
to
even
me
matter?
that was important.
I think, well, and that's why it's over in Thailand and Vietnam and those places that it is important. That
matter.
get
Okay.
your skin light. If they're already getting their skin lightened, maybe they want their member to match.
Because I guess that
Alright.
would be weird.
Yeah,
If
you
you're,
want
like,
your
fair skin.
carpet
Just
to
one
match the
spot,
drapes.
yeah.
You know, it's. I
That's
get it.
funny. And so is it expensive? Like, is this an
Well,
expensive procedure?
About $650 for 5 treatments.
Oh my gosh, that seems crazy.
Now, how do they logistically apply all of this stuff? Are they rubbing it all over themselves?
Well, it's a
Are they-
laser. It's a laser
Oh.
treatment.
Gotcha. That's not as exciting as a massage.
Potentially.
Yeah, I've never had a laser down there, so maybe it is. I don't know.
Have you had a laser anywhere?
No, actually.
No.
Other than like the little pointer laser that people, point at you. But that doesn't count.
No.
That's it.
That's it. So mine, I've lost my story, so I'm going to go off the cuff on it. But Mine is a 4-month-old that, so I like pick specific people, not general ones, but it was in the United States, and it was a 4-month-old whose parents noticed that his head was growing faster than what it should have been. So I don't know if it was one area, one region. When he was in getting tested, they found that he had a tumor in his brain. Sorry, I have a cough. When they went in to take the tumor out, they actually found a kind of the formation of a jaw and 4 teeth inside of this tumor in his brain.
Oh, and I've heard of things like this, and it's just like the unborn
Well, and
twin.
they didn't say that specifically, but they said that it's considered a pituitary tumor. So the unfortunate part is that he will have some hormonal issues later. He'll have to take some replacements and stuff like that. But they actually pulled it out. In the article I read, they actually had like the little teeny teeth.
Oh.
It's not cute. You said all.
Would you keep it in a jar?
It's first tooth. For us all.
Well,
I just thought that was crazy that, so I guess tumors there are not that abnormal. This type of a tumor, and maybe we'll do it in our notes section or our references. Yeah, they pulled it out and actually found that there were 4 teeth and like kind of the formation of a small jaw.
Do you think like they put it under the pillow for the tooth fairy? Because I kind of think he should get a little extra.
Well,
for
I
that.
hope he doesn't have a pillow because he's 4 months old and he shouldn't have anything in his crib.
Oh yeah.
Yeah.
See, it's a thing.
Yeah.
Technical here.
Yeah. So, but yeah, I was just like, can you imagine, like how crazy? And I've heard of those types of tumors. They're like, oh, body encapsulated the twin or what have you. But yeah.
His pituitary gland took up the twin, I guess.
Yeah.
Huh? Interesting.
Strange. Yeah.
I had actually read an article of a guy who thought he had a lung tumor. They went in, did surgery, and they fished out one of those little toy traffic cones that he had ingested 40 years earlier.
What? So he inhaled it into his lungs?
Aspirated.
Yeah, when he was little. Then they obviously didn't find it then, but 40 years later he thought he had a tumor in his lungs. They went and did surgery and found the traffic cone.
There it is. I've been looking for that for
years. I swallowed a pen
years.
cap in high school.
Oh.
Yeah. Like swallowed
Because you
it.
got dared?
No, I didn't eat it on
That
purpose.
sounds like something that you
I
might
was
do.
actually talking to the kid behind me, and if he ever watches this, he'll know it was him. But I was talking to the kid behind me. The good news is, the caps that have like the pointy end of it, like that. I don't know if it's supposed to be. That I had chewed that off already. So luckily that wasn't part of it. It was just the top of a pen cap. And we were watching a video in history class, and I was talking to him, and I leaned back like that, and it started to suck in. And I sat up, and I was just like, and it went down. And at the time, I didn't really understand, biology or anything. So I was like, oh my gosh, it's in my lungs. So I waited till class was over. I didn't have any problems. But
Was it in your lungs, or did you actually swallow it?
So I supposedly passed it. I don't.
You don't remember the next day?
Well, no, because like my mom. So the school was like, you have to go to the doctor. I think my mom had to leave work and take me in. So they did an X-ray and they couldn't see it. And my lungs is what they were worried about. So they're like, she's gonna pass it. My mom's like, so you need to check, and because I was like 16, I was old enough. Yeah. This is like the same year I passed gas in front of people. It was a horrible year for me.
You had a bad GI year. No wonder you don't fart or poop anymore.
Yes, that's it.
All these
Who
horrible
needs a
experiences.
psychiatrist who what's got around? So I just to like appease my mom, I was like, oh yeah, and she's like, oh good.
But you never actually felt it?
No.
I can't eat a sunflower seed without knowing the next
really?
day. Yeah. You eat the shells of those things and it is brutal the next day.
I think maybe it was like the pointy bick and it just like slid right out. I'm assuming when it came up, but maybe it's sideways, and that's my whole problem.
It is still inside of you as we speak. In the corner of one of your...
Maybe I've got some big and, calcium and capsuled tumor of a pen cap in there.
We'll find it
Well, if
later.
we do a fasting episode, you might know, because fasting will kind of give
But it's literally, 20 plus years ago that this took place, and I lied to my mom. I was like, oh yeah, definitely came out.
Thank goodness it didn't come out sideways.
Yeah.
Ooh.
I don't know. And they didn't seem very
bleeding.
concerned about it. Like, it was like a walk-in clinic, and they were just like, yeah, she'll be fine. Just if you have any problems or any issues with,
Anal bleeding.
Yeah. Yeah. So that makes me wonder, but it definitely wasn't my lungs, so.
Nice.
Wow. Interesting. All right, so have you guys heard of something called purple urine bag syndrome?
No.
It is.
Of course not. Oh my gosh, I have, yeah.
Oh, yeah, that. Well, actually, it wouldn't surprise me if you guys have seen this. In our profession, I have seen it once, and I actually took the person to the hospital because of it. and just didn't know. And so basically it is purple urine in a bag. So if somebody has a catheter in them, and they're, like a Foley catheter, and their urine's going into a bag, it can turn purple.
Why?
Fluorescent purple, dark
blood purple,
like dark purple.
Yeah. So not like bloody.
Like Kool-Aid, like grape Kool-Aid.
Like a grape Kool-Aid purple.
And you saw it.
And I saw it and actually thought it was blood in the urine, thinking, okay, that's just a weird color of blood or whatever. There's some, maybe, the UTI that they have is making it a little bit discolored or whatever, but that clearly there's some blood in there or something, because I just never heard of it before. Well, it turns out there is something. So it's actually you've heard the term a cascade of chemistry, and that's is kind of what's happening here. So that cascade of chemistry all starts with tryptophan. We're all pretty familiar with tryptophan, makes you sleepy. Some people say, it's linked to the turkey you have at Thanksgiving.
Not the other 4,000 calories that you ingested.
Yeah, it has nothing to do with the big food bolus you just gave yourself. But tryptophan will break down into something called indoxyl sulfate. That indoxyl sulfate will go into your bloodstream and gets excreted into your urine. Well, depending on if you also have a urinary tract infection, which people who have catheters are prone to getting urinary tract infections, depending on the type of bacteria you have, bacteria break down the molecules around them and secrete byproducts. So certain bacteria will, the byproduct they release is called indoxyl phosphate. And so the types of bacteria would be E. coli, actually is a big one, and that's actually the #1 cause of urinary tract infections. P. mirabilia is one, and then there's several others. I can't remember them all now. There's 5 or 10. Anyways, so if you have a large amount of that indoxyl sulfate in your urine, and the bacteria that you have are producing the indoxyl phosphate, it will turn into indigo and indirubin. And indirubin is the organic molecule for red, and indigo is the organic molecule for blue.
Nice.
You put them together, and you get purple. So,
oh, how fun.
Yeah, it is fun. So, and actually, if you have, a lot of elderly people are constipated. So that's actually a pretty big risk factor, because if you're constipated, your body's breaking down that tryptophan, and you have an excessive amount of indoxyl sulfate, and then whatever UTI you have, depending on the bacteria, and you get your purple urine. So I looked at that and thought it would be fun to purposely give somebody a UTI and then make them eat a bunch of tryptophan.
I know how UTIs are caused, and you're going to purposely do that to somebody.
Well, depending, there is one way in a previous episode we had, you are literally massaging.
Yeah, no, I'm aware. I'm just
So it could be kind of fun.
Sadistic. I'm going to purposely give them a UTI.
There's some E. coli into your ureter. Take that. But we'll have purple pee later. Yay! But no, it does propagate in the bag. It takes some time for all that chemistry to take place. So if you didn't have the catheter and didn't have the bag for it to break down,
you wouldn't know.
Then you wouldn't. You're not just peeing out purple. It's actually turning purple in the bag.
Oh,
okay.
So that's why it's purple bag syndrome. And actually, it's been around forever. There's been tons of people, if you look up, that have mentioned it. It wasn't until 1978 before a chemist finally said, "This is what's happening, and that's what's causing the purple urine." And it's not actually. It doesn't really do anything. But the cure is pretty simple. Take some antibiotics, cure the UTI, and now you don't have your indirubin and indigo to turn purple.
Oh,
kind of exciting.
Yeah, interesting. That's like everything. It's like art, chemistry, medicine, all in one.
Art.
Well,
purple
purple
urine.
and red, or blue and red.
You go Jackson Pollock on it and just start splattering it over the walls.
Oh, he's even nerdy, like with his art. Jackson Pollock.
He's a famous artist.
How about Bob Ross?
You guys know Jackson Pollock. He's famous.
Yeah.
Do you really? No. He's the one that splatters the paint, and it's just like splattered paint all over the place.
Right.
Yeah, that's him.
Parker, when I took him to an art studio, he's like, he was young, and he's like, oh my gosh, looking at all the prices of, he's like, so basically anybody can be an artist and just slap a number on it.
Yeah.
Kind of.
In some cases. That's funny.
Yeah.
That's why they call it the Impressionist period. It's my impression of something.
Yes. Well, that flows nicely into my next title, Eye of the Tiger. Apparently, a Canadian model, Kat Gallinger, is at risk of losing her entire eye after having her eyeball tattooed purple.
What?
So
Yes.
is that why you called it Eye of the Tiger because her name's Kat?
Well, no.
Because that's ironic.
Yeah.
Yeah. No.
Well, tattooed her eyeball?
Yeah, it's a procedure called sclera staining. And apparently a guy named Lou...
Didn't Hitler do this? Like, this sounds like a bad idea.
Oh, yeah, it's terrible.
Yeah.
But, she decided that that was a good idea. There is a guy named, or I'm not even sure if it's a guy or a girl, Luna Cobra, who...
Ooh, what a cool name.
I know. I think there's some name changing in this.
I want to be a cobra.
What was the source for this article?
It's actually all over the news.
Is it?
Yeah, it's a big deal. She got this procedure. It's called sclera staining. Luna Cobra invented it in 2007. He warns against other people seeing copycats because he hasn't passed on his research or knowledge behind it. So it's
was he a tattoo artist or what was his
Yes,
profession?
he does all sorts of things. I went on his website and he does body modifications. So it's really big in the body modification.
Right. Because I was wondering what kind of a
section.
model was she where she would want to alter her eyes like that, because don't models want to kind of be,
Right. It doesn't say what kind of model. It's just a Canadian model. That's all
So they're actually taking a tattoo gun with the needle and straight into the sclera?
Again, you would have to go to Luna Cobra's site because he has
Explains it.
Yeah, he's the one that does it, and
I just feel like work one of our shifts and stay up all night and your eyeballs are red.
Yeah.
yeah,
And you get the raccoon eyes. You don't even need... What is that? Eyeliner? I don't know. I'm not
Either
I don't wear
or,
makeup.
yeah.
if you go to his site, it
incredible.
is incredible. Like the things he does. I mean, body mods. Like he gives people's horns. He
Yeah, I've
does
seen those before.
The split tongue. He does
the rings,
implants
yeah.
of
I've seen the ear on the forearm before.
He does those.
I've seen a guy with implants here, like in his chest, like spikes.
Yeah. Yeah.
You were doing a 12 lead on
And
him,
he
I was like, whoa.
apparently they're like some people are into getting their belly button sewn up, and I mean this guy is a
Does
true
everything.
artist. He does everything.
He's a
I mean,
true
he's
artist.
really, if you want to mess
Body
with
art.
your body,
That's
he's
the
the
guy
one
to
to
go
go to.
My favorite body modification was at the World Series of Poker. This guy bet another guy that he wouldn't get breast implants and keep them for a year.
Yeah.
And so he got like $100,000. So he did. And then, but the best part was after a year, he liked him so much, he just kept them.
Oh my
Because
God.
why not? These things are amazing. Just
That's crazy.
Yeah.
Interesting. Yeah, I just couldn't imagine. Like, that seems very... I mean, like, I get tattoos and things like that,
Yeah.
but, like, messing with one of your main
Eyeballs.
senses, like your
Yeah.
eyeballs.
Yeah.
or
How do
your-
you even tattoo that? Do you,
apparently
like-
many people have gone blind from going to people that don't know what they're doing. Yeah.
Yeah. And I would guess, like, these are people that don't typically, like, they're obviously risk takers or daring when it comes to this stuff, so maybe that's what it is. It's a draw, but,
Yeah.
interesting.
fun. Good times.
Well, thanks for tuning in today. Hopefully you enjoyed this little different episode into some of the you can't make this stuff up.
If you like what you saw or heard today, check us out on our website,
Or visit our YouTube channel.
medicalconfessions.com.